Well, you know, March is Colorectal Cancer Awareness Month, and we'll talk with someone who knows firsthand why it's so important to get screened for colon cancer. All right, so welcome back, everybody. You know, colorectal cancer is the leading cause of cancer death for men and women combined across the United States. And, you know, we have to talk about this. I have a good friend of mine, new friend. He called himself a victim. This is Keith Barton. He's actually a colon cancer patient who just had his surgery in December. We're going to talk about that and his doctor, who may have just saved his life, Dr. Tom Magrino. All right, so Keith, tell us a little bit about what happened. How'd you find out?
I went in for a traditional screening, and the doctor found an issue as part of the colonoscopy. And so it turned out to be cancer, and so they recommended me for surgery.
That quick, simple, and easy.
That quick and simple,
yeah. So had you not gone to get that screening, what would have happened?
Well, potentially it would have spread to other internal organs and been quite a problem. As it was limited to the colon, and as a result, I have a high degree of survivability.
That is good news. Now, he is one of the good news stories about screenings, because we all know a lot of people don't go and get those screenings. Talk to us a little bit about that, Dr. Tom.
Patients are afraid of screening, and I think that a lot of it is generated by folks who overplay the discomfort involved in screening, overplay the issues with the prep. You do have to take medicine that gives you about 5 hours of diarrhea. You do have to come in and have someone put a snake up your bottom. But we sedate people. Excuse me, I just did colonoscopy yesterday, and 2 of my patients started to wake up, were not uncomfortable, didn't want any more medicine, were entertained by watching their colonoscopy.
It's that simple. A lot of people have this fear, and you can probably speak to that. You probably know other guys that are like, no, man. Are your friends kind of changing their minds about screenings now?
Well, it's, as the doctor described, you spend the first 49 years defending that posterior from all comers, and then suddenly the medical community comes and says they want to put periscopes and microscopes and everything. So you're a little defensive, and as a result, you have a tendency to kind of hold them at arm's length and say, I'll do that next year, honest. So it is a little bit of intimidating.
Okay, so talk to us a little bit about life. You had surgery in December, but it's not over for you, because you did have some signs of colon cancer.
So they prescribed 6 months of chemotherapy, and the chemotherapy is usually has a number of side effects like intemperance to cold and diet. So there's been some issues I've had with the chemo, much easier than the surgery, actually.
All right, but you're here to tell the tale and to share with other people about how important screenings are. Okay, so what is your advice, doctor, out there? What's your advice, patient out there?
Get screened.
Get screened. It could save a life.
Yes.
Early and often.
Early and often. All right, and it didn't hurt that bad, did it?
Nope, wasn't a problem.
You heard it here first. It wasn't that big of a problem, and he's here to tell the tale. And I'm sure your family is so happy that you're still here with us,
Well,
right?
that's still in doubt. But yeah.
I love it. All right. So thank you guys for coming on and hanging out with us. You guys are going to hang out and watch a little bit of this show live?
Yes.
Maybe. All right. So you are going to hang out and watch this show live, because coming up next, the city of San Francisco is being